Yes, students, very good morning. Today we will discuss about new anti-TB drug restrictions, and we will also see what is the government policy and what will be the government policy, what is the government policy dilemma right now on the new anti-TB drugs. So before we are diving into the topic, let us try to understand few things here. The first one, what you have to understand it, what is a TB? Generally, a TB is nothing but tuberculosis. It is a bacterial infection. It is a bacterial infection that mainly affects the lungs but can also affect other parts of the body. The second one, drug resistant. TB, drug resistant, which means that when TB bacteria is no longer responding to the usual drugs which are used to treat the tuberculosis. The third line you have to understand is called, it is a first line drugs. The first line drugs are basic medicines used to treat the normal cases of the TB. So which is a frontline medicines indirectly. It is a basic medicines. And you need to understand another technical called as patent drug versus a generic drug. So generally a patent drug, they are the drugs which are legally protected from being copied by the other companies for a certain period of time. Usually it is 20 years. A generic drug, normally it is a medicine that are made by other companies once the patent expires. So they're generally usually cheaper because there is no lot of research and development. Already the research and development was done by the patent company, the primary company, and they already filed a patent. The 20 years has been over. Now the other companies also can use the same formula and they can generate a drug called a generic drug. So for them generally they are very much cheaper compared to the patented drugs. The another term you have to remember here is NTEP, which is nothing but National Tuberculosis Elimination Program. It is a TB elimination program, right? So the another technical term you have to understand is GDF, that is Global Drug Facility. These terms are very much important before we are diving into the topic. Global Drug Facility. So this is the Global Drug Facility. It supplies the quality assured TB medicines globally at low cost. So we know that anyway the TB is largely affected in the underdeveloping and the lower developed nations. Most of the developed nations, they get rid of it, even though they have at some portion, but they are very much richer compared to the other countries to handle this kind of the thing. So the Global Drug Facility, generally it supplies the quality assured TB medicines globally at low cost, preferably to the underdeveloped nations. And another term you have to understand is Nikshay Aushadhi. The Nikshay Aushadhi is a digital system to manage TB drugs. It is a digital system. Please make sure that it is important for the prelims examination. It is a digital system to manage TB drug stocks and distribution in India. So it is a digital system which manages the TB drug stocks and also its distribution as well. Clear? The another term you have to understand is anti-microbial resistance, that is AMR. When bacteria or viruses are no longer respond to the medicines, that once killed them. It is called as anti-microbial resistance, which means that you are using a tablet generally to kill some bacteria, but you are using continuously over a period of time. That microbial resistance will be not there. So even though if you use the same tablet again for that disease, it will not be effective. So that stage normally we can call it as a antimicrobial resistance. The another technical term you have to understand is DOTS, that is directly observed treatment short course. Directly observed treatment short course. It is a method used to ensure patients complete TB treatment, because some people start the treatment, they will not finish it. They may feel that the symptoms has been reduced, but that is not true. So we need to finish the entire treatment process. That is called as directly observed treatment short course, DOTS. Now we will dive into the topic. What is this new anti-TB regulation and what is the policy dilemma for the government of India? Now we know that the tuberculosis, that is called as TB, is still a major health challenge in India. The government provides TB treatment free of cost through its National Tuberculosis Elimination Program. Over time, newer and better medicines like Bedaquiline, this is one of the medicine we used for the TB treatment, and Delamanid and Pretomanid. Maybe in the examination they may ask in such a way that these type of the medicines will be used to treat which type of the disease he may give. Thus generally these are the TB related medicines. So over time, the newer and better medicines like Bedaquiline, Delamanid and Pretomanid, they have made it easier to treat drug resistant TB. So these medicines work faster and easier to take. Recently, the Indian drug regulator, that is Drugs Controller General of India, that is DCGI, they proposed to restrict these newer TB drugs. So they are available only through the NTEP, that is National Tuberculosis Elimination Program, and not freely in the open market. Actually, this move has a good intention but also raises a serious concern. Right? Now we will see what the government wants to do. The government restrict the new anti-TB medicines, that is what we discussed. This is Bedaquiline and Delamanid and Pretomanid. So they are available only through the government channels like NTEP, that is National Tuberculosis Elimination Program. What the main reason for that? To prevent overuse of these powerful drugs in the private market and also to stop the drug resistance. Does it really makes sense? To some extent it is yes actually, because when drugs are freely available, they are sometimes misused by the private doctors or untrained practitioners. This also leads to the drug resistant TB. So which is harder and more expensive to treat generally. By making these drugs available only through the NTEP, the government can monitor usage more strictly and ensure proper treatment. But there is a big problem. If you do like this, what is a big problem? If NTEP runs out of stock, let us assume as a case, if NTEP runs out of stock, there is no other way for patients to get the drugs. And this has already happened actually in 2023-24. This is not now. This is not an assumption. This was already happened in 2023-24. A nationwide stockout left many patients without treatment. So the patients had to run around for the medicines and some had to skip the doses. Actually, this situation worsens their health and increasing the drug resistance. So such events also break public trust in the government systems. So what we can do, what the government should do? Ensure continuous supply of the TB drugs through the better management of the Nikshay Aushadhi system, because it is a digital portal, right? Just now we discussed. and make sure that the drug stock, the data always should be available to the public, and train health workers properly to use the Nikshay system for requesting the medicine from time to time. And the fourth one, involve the panchayats and local bodies in monitoring and reporting stockouts. Use the TB Mukt Panchayat initiative if it is possible. Please refer it. TB Mukt Panchayat initiative. They can use it. And allow temporary private sales in emergencies. This is very much important because complete taken out is not a great idea. So temporary private sale in emergencies should be allowed. And explore non-profit or generic options that can still follow the responsible drug usage rules. So non-profit or generic options exploration is also it will also help you actually, because it can follow the responsible drug usage so that it will be always safe to use. So what we can conclude here is the decision to restrict the newer anti-TB drugs to only government supply is a good step to prevent drug resistance, but good planning and strong systems are needed first. Otherwise, it will only create a new problems like drug unavailability, patient suffering, and loss of public faith in health programs. So the goal should be access with control, not total restriction. That's what we want to tell. The goal should be access with control. This is good, and we are not supporting the total restriction. It is not a good idea. So if India wants to eliminate tuberculosis, it must ensure every patient gets the right medicine at the right time from a trusted source. For that, there is no need to go for the total restriction. You can go with access with control. Thank you.